Welcome to the third webinar in our Mental Health Week series. Today, we're going to talk about psychological health and safety in the return to work process. Today, I'm joined by Kim Keating, Manager of the Return to Work Program Services here at WCB. For anyone who has not viewed our previous webinars, my name is Jennifer Dick. I'm a certified occupational health nurse and work as a prevention consultant at Safe Work Manitoba. Safe Work Manitoba is a division of the Workers' Compensation Board and is the public agency dedicated to the prevention of workplace injury and illness. Working with our partners in the safety community, we provide prevention education, safety programming, consulting, and strategic direction to create a genuine culture of safety for all Manitobans. We'll start with a disclaimer. This presentation is not a substitute for legal or health advice and should not be relied on as such. Viewers should seek their own legal and health advice and/or follow your own workplace procedures. We've made every good faith effort to ensure the information is up to date. Today, we're going to talk about psychological health and safety and the return to work process. We're going to build on our previous two webinars for Mental Health Week and dive into the importance of creating psychologically healthy and safe work environments in the context of return to work. Two very important topics that we'll bring together. We'll review return to work principles and leave you with some key takeaway messages. We know that mental health is as important as our physical health. At Safe Work, we want to share that message that mental health is part of safe work. You play a significant part in making this happen. By being a leader in creating psychologically healthy and safe work environments, we can all work together to share in this message. This is not only important as we talk about workers and leaders at the workplace, but also for folks who are off work due to illness or injury and will be returning back to the workplace. Our focus for today is to really explore that intersection of psychologically healthy and safe workplaces and return to work. I shared this strategy with you this week. And one of the tactics under promoting the implementation of the CSA standard is to really work with return to work to incorporate mental health considerations into employers' return to work programs. So really enhancing those partnerships by working with partners to build resources and increase the capacity to build awareness. And if we take a look at the numbers and couple that with the amount of time we spend at work, it really does paint a picture for us. We spend a lot of time at work. A full-time employee, according to Stats Canada, works an average of 37.5 hours per week, according to Stats Canada. That's a really significant portion of time. And one stat that I read is really that 2/3 of us will spend 60% or more of our time at our workplace. And that's according to Assembling the Pieces. And when we think about these stats of 1 in 5 people in Canada will experience a mental health problem or illness, and that last week, 500,000 Canadians missed work because of a mental health problem or illness, the need to ensure our workplaces are psychologically healthy and safe really becomes more significant. It is each and every one of our responsibilities to take care of our health, but considering that we're spending so much time at work, how do you think our workplaces can contribute to that environment of psychological safety, but also really kind, caring, supportive, and really encouraging environment? And this is really important, not only as we support workers at work, but also in the return to work process. If someone is off work and they start to think about going back, if they know they're going to a psychologically safe workplace, it may make that transition easier. Kim is going to take us on a journey through that return to work process through that WCB lens, but I really want to bring your attention first back to that standard, the CSA standard, a tool, if you will, a roadmap. This can be an asset to all workplaces. The CSA standard can help build a system of psychological health and safety in the workplace. The CSA standard on workplace psychological health and safety, although voluntary, has so much impact. And we see more and more employers adopting the standard as a way to incorporate psychological health and safety as how they do business. According to an Ipsos Reid survey, in organizations implementing the standard, 5% of employees say their workplace is psychologically unhealthy. Compare that to 13% in organizations that are not implementing the standard, who say their workplace is psychologically unhealthy or unsafe. So to support psychological health and safety at work, starting on this journey of implementing the CSA standard for psychological health and safety in the workplace would be a great first step. You saw this slide yesterday, but I really want to redirect you to the importance of these psychosocial factors, these 13 psychosocial factors. If we address these factors, we know that we're creating an environment of psychological health and safety. Unaddressed, these factors can really impact our mental health at work. For example, it's easy to see that psychological harm may be a factor for a person experiencing bullying at the workplace, or for a person who is extremely busy, or even a person who doesn't feel that their work is meaningful or has been recognized. If this individual were off work, it might be challenging to return back to that workplace knowing that they're likely coming back to that same situation. And this is really why it's so important to look at creating psychologically healthy and safe workplaces using the CSA standard or something similar, where you're creating that psychological health and safety management system where these factors are reviewed, understood, and addressed. And as part of the CSA standard, you really want to look at your policies. You want to make sure they're in place. You want to make sure they're addressed, that they include a component of psychological health and safety. And this includes your return to work policies. I'd also like to mention that not only is the CSA standard something that workplaces should morally consider, but there's also really an opportunity for financial gains. I've taken several courses in psychological health and safety, and I've come across many documents. One in particular speaks to a return on investment. Deloitte Insights, as you'll see on the screen, conducted research on 10 Canadian companies and reported on 7 of them. And what they found was that when implementing measures to protect the psychological health and safety of workers, they actually saw in some places a return of investment of up to $4.10 for every $1 spent. And yes, this came over several years, but what they continued on to say is that workplaces with the greatest returns are those who are at various stages of implementing the standard. And Deloitte continued on to confirm that although the best returns were seen when psychological health and safety is implemented across the entire workplace spectrum, so from hire to retire, return to work played a vital role. And really having those robust return to work programs was a contributing factor to seeing that significant return on investment. Another article reviewed from Center for Addiction and Mental Health indicated that having mental health supports and training for leaders and having employees a part of the process were all indicators for successful return to work. I'm going to pass it over to Kim Keating to continue on with our return to work discussion.
Thank you so much, Jen. So, not to give away the information on the next few slides, but the WCB of Manitoba has been seeing a gradual but steady increase in the number of psychological injury claims. The severity and impact of psychological injuries is a growing concern to WCBs across the country. We cannot ignore the issue. The tagline of any WCB is whether it's a physical injury or a psychological injury, the most effective way to minimize the impact of workplace injuries and illnesses is to prevent those incidents from occurring in the first place. However, if they do, the most effective way to minimize their impact is to have an effective return to work program that applies to both physical and psychological injuries in place. Before I get into the WCB data, it is important to note that there are limitations to the data. WCB data only captures psychological injury claims that have been accepted and paid by the WCB. It does not include claims that may have been coded as an acute injury at the outset of the claim, but may also have psychological elements contributing to the ongoing disability. The data presented is static, meaning that it's a moment in time or a snapshot. Due to the nature of psychological injuries, there may be delays in adjudication of those claims, and then there are at times also sometimes delays in WCB being notified of a psychological injury, and retroactive decisions may result. There may also be legislation changes that can also impact WCB data. And in 2020, WCB data was impacted by the COVID-19 pandemic. Before I share WCB and Manitoba's data, I want to give you an action item. So write this down. What do your numbers tell you in your workplace? Is your workplace experiencing the same gradual but steady increase of psychological injuries that the WCB is seeing? And what about absences that are not considered work-related? Is your organization seeing an increase in disability from the workplace related to mental illness? Now let's look at the WCB data. So as I mentioned, psychological injury claims accepted by the WCB have been increasing slightly year over year. Whereas what we have also seen is that all other types of injuries to the WCB have been gradually decreasing year over year since 2016. Again, WCB data represents a snapshot in time. Adjudication decisions continue to be made on injuries from prior and current years, which may limit some of the data accuracy. In 2020, psychological injury claims to the WCB of Manitoba represented 1.5% of total WCB accepted injuries and illnesses. That number may seem relatively small. However, when you compare it to 2016, that number represented less than 0.7%. From 2016 to 2020, psychological injury claims have increased by 30% in the average WCB cost per claim, 19% in WCB claim duration, and 172% overall increase to WCB claim costs since 2016. Other injury type costs have decreased in comparison to the WCB since 2016. In comparison to other types of WCB claims, psychological injury claims represent a small proportion. However, they are rising in terms of number of overall claims, cost per claim, and claim duration. This slide represents WCB total claim cost trends from 2016 to 2020. What you can see is that upper line, the green line, represents total accepted injuries and illnesses and the costs to the WCB system from 2016 to 2020. The blue line on the bottom represents the cost of psychological injury claims to the WCB of Manitoba over that same time period. This slide represents the average cost per WCB claim trend. So what you can see is that the average cost for all types of injuries and illnesses in 2020 was just over $4,000. Whereas in comparison, the average cost for psychological injury claim to the WCB of Manitoba in 2020 was just over $17,000. And this slide takes a look at the WCB average days lost per claim. And again, when we look at the green line on the bottom of the graph, that represents total accepted injuries and illnesses to the WCB of Manitoba. So on average, a time loss injury claim that comes to the WCB of Manitoba, there are 34.3 days lost per claim. In 2020, a psychological injury claim that came to the WCB of Manitoba, on average, there were 122 lost days per claim. And that number in 2020 is a bit of an anomaly year that sticks out. However, that number is always and consistently significantly higher than the average duration of all claims coming to WCB. So before I show the next bullets on this slide, I want you to take a moment and just jot down what you would expect or what you would anticipate the top 5 occupations would be for WCB accepted psychological injury claims. Okay, so now I'm going to show you the answers. So the number one occupation group that with the highest number of psychological injury claims accepted to the WCB of Manitoba during the period 2016 to 2020 is the occupation grouping of correctional service officers. The second group are ambulance attendants and other paramedical occupations. The third group are bus drivers and other transit operators. The fourth group are community and social service workers. And the fifth group are registered nurses and registered psychiatric nurses. Let's consider two scenarios. In these scenarios, we're going to put different hats on of different roles that people may have within an organization. So the initial role that you're going to play is the role of the return to work coordinator within your organization. And you have two scenarios. Maybe you've experienced scenarios similar to these two. Scenario number one represents a traditional physical injury. Perhaps it's a sprained ankle or a broken ankle. Scenario number two represents a worker with a psychological injury. In each of these two scenarios, the worker has brought in a functional abilities form to you with the following abilities and limitations outlined by their healthcare provider. And you, as the return to work coordinator, have to determine if you are able to offer an accommodation to this worker that is safe and suitable for the worker to return to. Let's look at the scenarios. So scenario number one, the traditional physical injury. The functional abilities form indicates that the worker can return to work and they must be able to occasionally elevate their ankle. They also have to limit the use of stairs, and they are to avoid long periods of standing or walking on uneven ground, climbing ladders, deep squatting and crouching with or without weight, and activities requiring balancing, bracing, running, or jumping. Scenario number two, the psychological injury scenario. This worker likely returned a cognitive abilities form to you, the return to work coordinator, that indicates that this worker may have difficulty multitasking. They may have difficulty concentrating due to decreased stamina and possibly fatigue. This worker can be expected to be able to work on a regular basis in environments that allow for flexible schedules and or regular breaks. And this worker may have difficulty with tasks requiring significant memory and expected to perform adequately with tasks with moderate expectations of memory. If I put my manager hat on and I am looking at these two scenarios, I know that when I read the worker's restrictions or abilities in these two scenarios, I feel differently. I have a more difficult time visualizing what a successful return to work plan will be for the worker in scenario number two, and how I'll know and be able to measure success. I am confident, though, that I'm able to accommodate scenario number two, but it's not going to be as straightforward as scenario number one. And it may be more likely to be a long-term accommodation. I'm not exactly sure how to appropriately accommodate scenario number two, and I feel like I will likely need some additional support from both the return to work coordinator in my workplace as well as the workers' compensation board. Now, if I switch hats from my manager hat to the worker hat, let's pause and think of these two scenarios from a worker's perspective. What might a worker be experiencing in these two scenarios? The emotions and experiences a worker may have and may be feeling about returning to work in scenario number two may be quite different from what the worker in scenario number two might be experiencing and feeling about the possibility of returning to the workplace. When workers are absent due to psychological injuries or mental illness, they may experience concern about being a bother to others, rejection when they return to the workplace, isolation, and possibly shame. They may also fear potential harassment and other associated stigmas that may exist. Oftentimes, psychological injuries are caused by incidents that involve helping or protecting others, such as correctional officers, ambulance attendants, community social service workers, and nursing. There is often shame that they had to go off work or a feeling of inadequacy to do their job. What will my coworkers and supervisors think of me when I return to the workplace? During the planning stages, it should be discussed how the absence will be explained and what will be shared with the rest of the team when the worker returns to the workplace. And it's important that we really listen to what the worker wants in those to be shared. Now, if I'm the return to work coordinator, I'll put that hat back on again. What are some return to work strategies that I can provide to support the individual in scenario number 2? The strategies that I'm going to use for scenario number 2 are also helpful in scenario number 1, but due to the complexity of a psychological injury, the importance of having these concrete strategies developed and in place comes into focus. As the return to work coordinator, I would proactively implement some of the following strategies. Number 1, I would encourage the worker to enlist support both at work as well as outside of work. And this includes both formal, such as through their healthcare provider, as well as informal, through supports through family and friends. Encourage the worker and incorporate that the worker maintain their treatment plan as part of their return to work plan. Anticipate coworker and direct manager or supervisor discomfort, and how will that be addressed? Number 4, adjust expectations. Return to work planning is not a one-time event, but it is a process of gradual transition that is adjusted to reflect the worker's recovery. And number 5, be prepared to monitor and adopt the return to work plan. What does research say? This is an infographic that was developed by the Institute of Work and Health following an Australian study that compared outcomes of musculoskeletal disorder claims and mental health compensation claims for injured workers. The study followed 869 injured workers for a period of 12 months. This study was based in Australia, not Canada. There are some different terms that are used. However, in my opinion, the study and infographic in particular are a great discussion piece for both your leadership team as well as your return to work teams within your organization to use as a discussion with respect to how workers in your organization are supported with return to work following psychological versus physical injuries. I encourage you to review the full study, which can be found on the Institute of Work and Health's website. The study identified that workers off with psychological injury had poor return to work experiences in 4 areas: personal, healthcare, workers' compensation, and the workplace. Findings showed that workers with psychological injuries are less sure about returning to their previous job, are less likely to be contacted by their workplace return to work coordinator, are less likely to be offered and accept modified duties, face more negative reactions in response to the injury from their supervisors and coworkers, and experience more stressful interactions with healthcare providers, return to work coordinators, and claims agents. So this is the final slide that I'm going to leave you with today before I turn things back over to Jennifer to wrap up the webinar. 7 principles of return to work. What can we do to support return to work following psychological injuries? The return to work principles that we lean on to support workers following psychological injuries are the same principles we lean on to support workers following physical injuries. The importance of these principles, though, is amplified due to the severity of injury and complexity of rehabilitation, as is often the case with psychological injuries. This slide references 7 principles of return to work that we have adopted from the research done by the Institute of Work and Health. We have good evidence and experience using these 7 principles for physical injuries. Let's look at applying them to psychological injuries and return to work. As you can see, as we review the 7 principles, there are many interconnected elements between the 7 principles and the CSA standard for psychological health and safety. Principle number 1, organizational commitment. Is there clear commitment for a return to work that is demonstrated by behaviors of workplace parties, including senior leadership? People often talk about what they believe or support, but actions speak louder than words. Is there an investment in company resources to support return to work following psychological injuries? And is labor or the union also engaged in the development of the return to work program? Principle number 2, safe and suitable accommodations. The employer must have a process to offer safe and suitable modified or alternate work to injured or ill workers that aligns with their abilities and recovery. This needs to be frequently reviewed and adjusted to maximize the benefits of return to work and support a worker's recovery, with the goal, when appropriate, to return the worker to their pre-injury work. Principle number 3, a supportive workplace culture. The workplace culture must genuinely support psychological health and safety, as well as return to work and worker recovery following an absence related to mental health concerns or psychological injury. Return to work planners must ensure that the return to work plan supports the returning worker without disadvantaging coworkers and supervisors whenever possible. Principle number 4, knowledgeable supervisors who are trained in the employer's return to work program. Supervisors must be trained and knowledgeable about the return to work program and should be included in the return to work planning process. Supervisors should also be trained in talking about mental health with workers and should also know that they are also supported in supporting employees and workers return to work following psychological injuries. The interaction between a worker and their frontline manager or supervisor is absolutely critical to success, and trust is a critical element to this success. Principle number 5, proactive communication with the worker. Early and considerate contact with the injured worker should be made. It should be made clear that the employer supports the worker with their recovery. Communication should be proactive and ensure that the worker is aware of the supports available and how to access treatment and supports. Principle number 6, having a dedicated return to work coordinator. There needs to be someone in the workplace that has the dedicated responsibility to coordinate return to work. And ideally, this person has experience and training in facilitating return to work conversations about mental health and is also very knowledgeable about company benefits and other supports available to workers recovering from psychological injuries. The workplace needs to have a process to identify and review a worker's abilities. For more severe injuries, this may be more complex, and the return to work coordinator may need to tap into external resources or the support of the WCB. Data confirms that the severity of psychological injuries is often higher. Return to work coordinators should request information about the worker's abilities with the worker's consent to determine if they are able to accommodate the worker. Ideally, the return to work coordinator will have access to both physical and cognitive demands of a worker's job to ensure that an accommodation is safe and suitable for the worker to return to. I'm now going to turn it back over to Jennifer.
Thanks, Kim. For our last slides, we really wanted to share with you some practical takeaways from today's webinar. And one of the first ones to talk about is really having an awareness and an understanding of the CSA standard for psychological health and safety in the workplace. It's really important to understand that it's not only about building this into your program, it's about really building that psychological health and safety management system and culture of psychological health and safety at your workplace. It's also really important to be a champion and be a leader in building psychological health and safety into your workplace. So really driving that message home that it's really important and that it's a part of the process. It's how you do business. It's really about building psychological health and safety into your return to work program as well. Looking at your policies, does it include psychological health and safety? Using those principles that Kim told us about and really understanding what they mean in the context of return to work and maintaining and building and creating that psychologically healthy and safe workplace. And finally, really being kind, being considerate, be kind to yourself, be considerate, and be empathetic to others as we're all in different places as we return to work and really building those psychologically healthy and safe workplaces. We've used several resources today to build this webinar. The first couple, as we've looked at the return to work program services on the website, on the WCB website. Safe Work Manitoba has a psychological health and safety toolkit. We looked to Canadian Mental Health Association, the Canadian Standards Association, Workplace Strategies for Mental Health, and Canada Life. Kim spoke at length about the Institute of Work and Health, IWH, and finally NIDMAR, National Institute of Disability Management and Research. That concludes our presentation on return to work and psychological health and safety. And as we've heard today, it's really important to note the intersection of psychological health and safety and return to work. If we all work together, we can make sure we're addressing the needs of workers as they return to work, both physical and psychologically. If you have any additional questions, please do not hesitate to contact Kim or I. Our contact information is on the screen. On behalf of Safe Work Manitoba and Workers' Compensation Board of Manitoba, thank you so much for watching our virtual presentation today. We hope you were able to take away some tools and knowledge to better understand that intersection of psychological health and safety and return to work. In the coming days, you'll be able to review the complete recording of this webinar and share it with your colleagues. It will be posted on our YouTube channel. Please be sure to visit safemanitoba.com and wcb.mb.ca to view resources and to learn even more about keeping yourself and your workplaces psychologically healthy and safe in the return to work process. Check out the Psychological Health and Safety Toolkit and return to work resources on our websites. Thank you.